If you have cancer, you naturally want the best possible doctors and specialists treating you. In this chapter, you'll hear the term multidisciplinary care. That's where your medical specialists work together to make sure you're getting the finest quality treatment. Remember, you have every right to ask a second opinion, and it's important to ask the right questions to make sure you and your medical team are on the same wavelength. There's a list of the questions to ask your doctor at the end of the chapter and in the booklet that came with the DVD. Where possible, make sure you take someone along with you to all your appointments. I know how difficult it is trying to take in all that information on your own. So having someone there beside you can really make a difference, and they can give you a bit of emotional support as well.
It helps to have someone with you, although if you feel you want to do it on your own, do it on your own. I had my husband with me at all my appointments. I think it's important to gather as much information as you can, because when you've gathered information, you can make a more informed decision about alternatives. And I chose to do chemotherapy, but I also investigated alternative therapies that could support my body while I was undergoing chemo. So I think it's important to have the facts in front of you, because there were times where I was creating scenarios and getting anxious over snippets of information they were giving me. But when I had the whole picture, I could understand it more.
Once you've been diagnosed with cancer, there are lots of different things that happen very quickly. And one of the most important things to remember is that the doctors looking after you are trying to gather a lot of information about the stage and the grade of your cancer to enable the best treatment decision and recommendation to be made for you. I think often people feel that they're on a roller coaster when they're first diagnosed with cancer, because their mind doesn't have time to catch up with what's happening to their body. Please be reassured that everyone understands this, and they are working towards getting you the best treatment recommendation possible, as well as getting your brain to catch up with what's actually happening. There are many opportunities to ask questions, and you will have many questions for the doctors. Please remember that everyone is happy to answer questions as you go along. Some of the things that may happen once you've been diagnosed are that you will need to have lots of x-rays or scans. These show the oncologists where the cancer may have spread to, or more often where it has not spread to. Patients also need to have biopsies, and sometimes they need to have operations, they need to have tests to make sure that their hearts and lungs are functioning properly so that they could undergo the treatments that they need.
Next 2 weeks he had me doing tests after test after test to make sure I was fit to do it. And it all went so fast I didn't have time to think. I didn't have time to worry about it or anything. Every day it was more tests: liver test, heart test, lung capacity, blood tests. And so on and so forth. If I have another blood test, I reckon I'll scream. But at that time, for 2 weeks, it was blood tests every day and other sorts of tests. And within no time, it was time to go into hospital.
It's really a term to reflect the best possible care that somebody can get. It is a term to encompass all the people that are going to look after you. So from your surgeon through to your medical oncologist, radiation oncologist, special nurse, the pathologist. It's an all-encompassing term to reflect a whole team of people working to make sure you get the best possible care. And the best way that it's been shown that if people are cared by a multidisciplinary care, especially in planning what care and treatment they should get once they're diagnosed, has shown that people get better outcomes, their survival is longer, they have a lot less replication and duplication of tests, their care is better coordinated, they feel much more supported. So there's a lot of benefits for the patients, and there's huge benefits also for the medical team working together. If you want to know, how do I know if I'm being cared for by that team? You ask your surgeon, or you ask the key person you have been first referred to, your key person who's given you the diagnosis, and you ask them, do you work within a multidisciplinary care? When you come back and recommend what care I should have, will I know that a whole group of you has made that decision? So I know that it is right that I have my chemotherapy before my radiotherapy, or that I do need this type of surgery and that's the best way to first treat the type of cancer I have. Or is it best that I have chemotherapy first? So that the whole team has planned it, and and they know as well. So you're not going between people, and there's no conversation between them about, or better, communication. They all know where you're at.
Cancer treatment is available both in the public system and in the private system, and there is no difference in what sorts of treatments are available. We have radiotherapy, surgery and chemotherapy in all our major public teaching hospitals and in all the major private hospitals. It really is a question of patients' preference and financial situation, which system they choose. Increasingly, indeed, patients choose to move between the systems, and the collaborations between the systems are getting better all the time. Some of the multidisciplinary clinics, for example, are shared between the public and private sectors, and this is a path that we are encouraging. One of the issues that worries patients with cancer entering the public health system is that they fear they'll have to wait longer for their treatment because they don't have private cover. The endless discussions about elective waiting lists only make this worse. I'd like to reassure you that cancer patients don't enter elective waiting lists. They're all treated as emergency patients, so there should be no longer waiting time in the public system than in the private for urgent cancer treatment. The Cancer Council and some other organisations have developed lists of questions that you might like to ask your oncologist about your cancer. These lists are not exclusive, and please remember that should you have a question that doesn't appear on this list, you should ask it. Everyone is happy to answer questions, and it's difficult for us to know exactly what you're worrying about unless you tell us.
And the next time I went, my husband came with me, and we had worked out a set of questions, and he was there to write the answers because, as I think many people are aware, you're not at your most relaxed under those conditions. And I found that I was inclined to remember the answer to the first question and the answer to the last question, but nothing really in between. And so I felt that this was very useful.
It's a good idea to write down a list of questions to ask your doctor before your next appointment. And when you're there, write down the answers so you can refer to them later. If you don't fully understand what your doctor is saying, say so and get him or her to fully explain. Remember, it's your life and you're relying on the information. Now, you can add to or change these questions if you wish, but here's a list to get you started. What stage is my cancer in, and what does this mean for my prognosis? Is there any indication that cancer has spread? Can my condition go untreated without adverse health consequences? What are the possible treatments for my cancer? What are their advantages or disadvantages? What are the likely side effects of each treatment? How long will the course take? Can I continue my normal activities during treatment? How do I decide which is the best option for me personally? What do you recommend? When will you know the treatment is working and how? What next if this doesn't work? What if I have a question or a problem? When am I going to see you again? Are there any supplementary treatments, vitamins or nutritional aids that would help me?